Hi, my name is Bobby. I'm going to be your student nurse today. We're going to administer an enema. First thing I'm going to do is I'm going to wash my hands. Once my hands are clean, I'm going to check my doctor's chart for doctor's orders. A couple things that I'm going to assess. I'm going to assess for any bowel disorders the patient may have. I'm going to assess for any abdominal distension the patient may have. I'm going to assess I'm going to assess for any increased intracranial pressure, glaucoma, or any kind of recent rectal procedures that the patient may have had. I'm also going to assess the patient's recent lab work. We're going to look for electrolytes, BUN, and creatinine. I'm also going to check the date and time of the patient's last bowel movement. We're going to check for the consistency and the color that the patient had. We're also going to check for the patient's sphincter tone. We want to make sure they're going to be able to hold the enema. We're also going to check for impaction to make sure there's no impaction before doing the enema. And the last thing we're going to assess is the patient's cognitive ability. We want to make sure the patient's able to get on a bedpan or on a bedside commode. We may have to modify our procedure a little bit depending on their cognitive ability for this procedure. Now that I've assessed all that information, I've gathered my stuff and I've come to the room. I'm going to wash my hands one more time and I'm going to introduce myself. Nursing. Hi, my name is Bobby. Can you tell me your name? Can you tell me your date of birth? Thank you very much. I'm going to verify that information with your armband. Great. Mr. Pierce, today we're going to do an enema. Have you ever had an enema before? What the enema is going to do is it's going to help clean out the bowel impaction in the bowel that you have in your stomach. It's going to help give you a bowel movement so you're not feeling so bloated. What I'm going to do is I'm going to get you in a comfortable position. So let me go ahead and raise the bed, and we're going to turn you on your left side and put your right leg over your left leg. This is called the Sims position.
Need help earlier?
No. I'm going to get the patient in a comfortable position so we can see. Alright. I'm going to go ahead and put on some gloves at this time. We're going to go ahead and roll the patient into Sims position. I would have assistance if we needed it, but Mr. Pierce is able to assist me in rolling and moving his leg. We're going to uncover him here so we are ready for the enema. A little bit. There we go. Alright, I'm going to go ahead and remove the contents from my enema kit. I'm going to put the drape underneath the patient. And then I'm going to use the KY jelly, and I'm going to lube up the end of the tip very generously, making sure that it is covered with plenty of KY jelly. Go ahead and get our enema bag ready. We're going to put the Castile soap and the saline in it to get it prepared. We're going to go ahead and generously again lube this up. We're going to insert it into the rectum slowly, making sure the patient's able to tolerate. We're now going to start our infusion of the warm enema slowly. We're going to make sure the patient can tolerate it at hip level. If the patient's able to tolerate it at hip level, we're going to go ahead and raise it now, 12 to 18 inches. We're going to allow the enema to go ahead and enter into the patient. We're going to make sure the patient's able to tolerate it. We want to encourage the patient to be able to hold this for 5 to at least 15 minutes if they can tolerate it. Once the amount of enema is in, we're going to close it off. We're going to remove it. We're going to give the patient some tissue and allow him to clean himself. We're now going to allow him to roll back over, and at this time we're going to encourage him to hold his bowel for the 5 to 15 minutes. We're going to assist the patient to the bedpan or the bedside commode. Once the patient has completed defecation, we're going to assist the patient back to the bed. We're going to get him back in the bed, and we're going to lower the patient back for safety reasons, back to the lowest possible position. Bed rails up. We're going to set the head of the bed back up. And get the patient positioned comfortably. Alright, now a couple things we're going to check for. We're going to evaluate the amount of stool return, the color, and the consistency of the stool return. We're going to evaluate how well the patient tolerated the procedure. And we're also going to evaluate whether or not there are other physician orders for continued enemas to help clear any other bowel until the bowel runs clear or what. We're now going to do some patient education and patient teaching. We're going to instruct the patient that enemas to prevent or continued enema use to help clear out any kind of impacted bowel can be dangerous. It can disrupt the normal bowel movement process. So we need to make sure that we may want to make some changes to our diet and increase our activity and our exercise level, because this is going to also assist with any kind of bowel movement activity in your normal bowel movements. Now that we've instructed the patient, we're going to go ahead and go do some documentation. A couple things we're going to document is we're going to document the date and the time the enema was given, the amount of enema that was given. We're also going to document the type of enema, whether it was a soap suds enema or a milk and molasses enema or a KX late enema. We're going to document the amount of stool return. We're going to document the color and the consistency of the return. And we're also going to document how well the patient tolerated the procedure. We're going to, before we leave the room, make sure we wash our hands, remove our gloves, discard of all of our equipment. And I think we're done. Thank you.